I mean, sometimes bad breath, it can be, not always. I mean, plaque on the teeth. I mean, you see plaque, dogs especially, most people aren't looking at their dogs or cats' teeth all the time. And, I tell people, hey, if you can look at their teeth once a month, you'll be probably doing pretty good. So, again, in dogs and cats, almost all of their plaque forms on the outside of their teeth. So when you're looking, just lift those gums, look at those canines, look at those molars behind it. And most of their plaque that will form is going to form on their upper dental arcade. So it's pretty easy to see. So of course, I mean, staining happens. So you do have to differentiate staining from plaque. Teeth will get a little yellow in dogs particularly, and cats too, but that's not necessarily disease in any way. So we're looking for plaque that forms, our teeth are very concave, shaped like a bowl. So we get a lot of our plaque form in that bowl, and then it drills a hole. Most of the teeth in dog are convex, like little mountains, so they get plaque that forms on the side. So when we start seeing plaque that forms, and particularly when we start seeing plaque that forms and is meeting the gum line, because at some point the gum line and the plaque are going to start fighting, and in most cases the plaque wins the war. You start getting gum recession and then root exposure. So I usually tell people, when you start seeing that plaque meet the gum line is really when I recommend, at least by that point, to do a dental cleaning to knock all that plaque off and to kind of start back over. So, most dogs, again, they're very dependent on the breed. Most dogs probably don't need a cleaning for several years. Some small breeds are exceptions for sure. And a lot of large breed dogs either may never need a cleaning, or they made it, like once in their whole lifetime. So, but when you're looking at those teeth, of course, really bad sudden bad breath is a big question. If you look at the gums and they're really inflamed and gingivitis, yes, that's a concern. But the nuance that most people see is, you're looking at those teeth once a month, is that plaque forming, and then as it met the gum line itself. So.